If you are on osteoporosis medication, can you increase your bone mineral density with exercise, or does the medication interfere with that? It's a hard question to answer for a few reasons. First, osteoporosis medication will increase bone mineral density. If you are exercising while on the medication, it's hard to know if any increases in bone mineral density are due to medication or exercise or both. Second, the effects of exercise on bone mineral density in people on osteoporosis medication may depend on the type of medication. Each osteoporosis medication has a different mechanism of action and effect on bone cells. For example, denosumab and bisphosphonates reduce both bone formation and bone breakdown, whereas romosozumab reduces bone breakdown and increases bone formation. Teriparatide increases bone formation more than bone breakdown. Third, most clinical trials looking at the effects of exercise on bone exclude people who are on medication for osteoporosis. Very few clinical trials examine the effects of exercise on bone mineral density in people on osteoporosis medication, and they're often very small trials or have limitations that make it difficult to make firm conclusions. Some studies are in very specific populations, such as people with diabetes, spinal cord injury, or a history of cancer treatment. For example, there's a study that recruited people on or off medication and randomized them to either high-intensity strength and impact exercise or a low-intensity control group. They only had data from 22 people on medication, or 11 who exercise and 11 in the control group, all on medication. 11 people per group is not a large enough sample to make reliable conclusions. The researchers reported no significant effect of the high-intensity strength and impact training on bone mineral density when compared to control in people on medication. However, we need a larger study to make firm conclusions. If you're thinking about taking medication for osteoporosis or are already on it and want to use exercise to reduce your fracture risk, here are some things to think about. There is evidence that osteoporosis medication alone can increase bone mineral density and reduce fracture risk. There are potential side effects, so you need to weigh the benefits and risks and talk to a doctor. In people who have a high risk of fracture in the next 10 years, the benefits of medication may outweigh the risks. Medications such as bisphosphonates or denosumab may decrease the amount of bone formation and bone breakdown that happens, but they don't completely stop it from happening. Romosozumab decreases bone breakdown and increases bone formation, while teriparatide increases bone formation more than bone breakdown. While there's some evidence in people not taking medication that strength and impact exercise may increase bone mineral density by a small amount, the evidence is low certainty and more variable. We don't have big, high-quality trials to understand whether it reduces fracture risk. How you train may influence whether it has an effect on bone mineral density. The type of exercise training done in clinical trials is often supervised and progressive, and often moderate to high intensity, which may be different than how people train when they're on their own. You should participate in strength and balance exercises whether you are on osteoporosis medications or not, to make you stronger, fitter, and more agile. Doing balance exercises can prevent falls, and falls are the most common cause of fractures. So, to recap, talk to your doctor about the risks and benefits of osteoporosis medication. We don't know for sure if doing exercise while on osteoporosis medication can increase bone mineral density. Even if you are on medication, strength and balance exercises will make you stronger, fitter, and more agile. Subscribe to Bones Lab on YouTube for the latest in bone health and exercise science.